Hi Liz, thank you very much for coming to Dublin to the Irish Association for Emergency Medicine meeting. I've been looking forward to this talk for a long time, and I think we heard some fantastic messages about you and your journey, and you inspired a lot of people today. Could you take us through some messages and take-home points for our audience today that might be struggling?
Yeah, sure. So I'm a breast surgeon who happened to have breast cancer. And I thought I knew everything there was to know about breast cancer, but I realised being a patient is completely different. As a doctor, you have no idea what your patient needs. You don't know what apps or websites are out there. And I think it would be useful to listen to patients and actually ask them what they need so you can signpost other patients in the future. I think in A&E you break a lot of bad news. You don't get the training that we do, and it's often in a busy room with people around. And it might be useful, especially when you're dealing with cancer, to get the cancer nurses to come down and tell you how to do it, what they'd like you to say. Is there any information you give to patients at the end? I'd also like to say doctors are incredibly busy, burnout is rife, and I think we need to remember to take time to look after ourselves. We are patients too, and if we don't take time out to exercise, to rest, to sleep, just to be mindful, we're not going to have the energy to look after our patients.
That's fantastic. I think we've just learned some really good life lessons today, and thank you again, Liz. You're amazing and awe-inspiring.